Gregory Johnson, and we're back today with a YouTuber who came in here to see us as a result of watching our YouTube videos based on spinal decompression and also hiatal hernia. So, Eloy, let's check your posture out first. Yeah, here we go. Now put your arms to your side. We always check posture first. Let's close your eyes and flex your head forward all the way. And then backward all the way. And then neutral. Now see, I could tell by him just doing that he has several little kink stair steps along the way. I don't know if you can see that from the side view, but his head's forward, his ear's way forward of his shoulders where it's supposed to be. His head tilts off to the left and is translated to the right, making his left shoulder higher. And when you go down a little bit lower, his pelvis has translated to the left on the x-axis, as well as his thoracic spine. And he's been having some pain in and around his rib cage area too, which is very important because that correlates with what is the underlying cause of hiatal hernia. The rib cage being misaligned, making the diaphragm weak, so the stomach slips up through that little hole in the diaphragm and secretes acid into the esophagus. So, Eloy, let's do the first time decompression on you today. This is a first time that I have done this on Eloy. Let's go back this way. This is only his third visit. Let's scoot you up that way just a bit. There you go. Now, this is a very dramatic adjustment to decompress the spine manually from the skull or the occiput all the way. Now this is going to be tight, Eloy. Just take a nice deep breath in for a second. Okay. Having a hard time getting the pin down in there. And it's not because Eloy's fat, it's just this pin's not being very cooperative. Alright. Let me do this. I'm going to lift these legs up first and see if that relaxes just a little bit more. Now, we always bring the legs up so where the bottom part of the legs are parallel with the table and or the floor. What this does is it changes the angle in his pelvis and relaxes the musculature in his spine. And let's see if we can get that one in there this time. Boy, I did eat my Wheaties this morning too. Suck it up real good for me. Huh. There we go. Now he's in there. He's not going anywhere now. Okay, Eloy, on this one, I'm going to need you to keep your teeth together. Make sure your tongue's not in between them. And I want you just to breathe in through your nose. Let your ear out and just relax. There we go. Good. Did you feel that all the way down to the lower back?
Yes.
Everything. See, this is the very first time he's had this done, and he actually did quite well. We always check the reflexes after that one. And I'm going to take this towel out of here. Whew. Is that the most dramatic adjustment you've ever had in your life?
Yes.
Uh-huh. Okay, let's put your hand right here and rest. There we go. Now that, okay, just let this go. There we go. Got one more right here. That's it. Better. Good. Yep. The first one's always the worst one. After that, they get a ton easier. But he will feel a sense of lightness and freedom after this adjustment. Okay, Eloy, now let's turn sideways and come over here and lay on your tummy. Now, because he has multiple conditions throughout his entire spine, we will be doing a full spine adjustment on him, so we always check the leg length. His right leg in this position is a ½ inch shorter. We bring it up. It gets even, actually even a little longer. Now see his pelvis raises up, that tightens up there, doesn't it, Eloy?
Yes.
That's called a positive Knockless test in Deerfield on the right, because his short leg actually got not only even but a little bit longer, so That tells me his right sacroiliac joint was out of place, so I'm adjusting that in the x-axis, the y-axis, and the z-axis. Now this middle bone right here in the pelvis is called the sacrum, and you notice I'm adjusting that straight superior to inferior. And then the left sacroiliac joint is going to be different. Now I'm moving up. There's L5, there's L4, there's L3, L2, and I'm not going to do any more of those. Okay, now I'm going to put your head down a little bit, Eloy, so we can stretch your joints out a little bit. There we go. We just do some lateral and oblique stretching on the patient so we can relax these areas and stretch the muscles and ligaments out. Now, because he's got so many ribs, there we go, missed the line, in the thoracic spine, this has weakened his diaphragm, and his stomach has slipped up through there into the upper cavity, creating massive. Now I'm going to be doing some muscle work right down here, Eloy.
Okay.
Right there. See, this one right here is right at T11, T12, which is the base of his thoracic spine, and are the last ribs down there, and lower rib cage is what the diaphragm attaches to. Those are all pretty sore, aren't they?
Yeah.
Yeah, there we go. And see, I'm putting a very deep, steady pressure. Now see, you've got real tight muscles right down here in the quadratus lumborum, multifidus, and rector spinae musculature, right at the lumbosacral junction. I like to call it the pocket. It's right down in the corner here of L5 and the sacrum. Now this hurts, but it hurts so good. Now, we recheck his leg length. They're exactly even. And Eloy, does this feel better than the rest of them?
Yeah.
Very good. So, I'm going to put your head down a little bit more. There you go. Now, because he's had some shoulder and upper back and rib problems here, we're adjusting T1 and T2 right there. But see, he's got these huge knots in his trapezius muscles. Those are called trigger points. They're full of metabolic waste products of normal cellular metabolism. When the muscles get tight, the fascia, which is the covering of the muscles, actually is so tight it won't let the blood carry in oxygen and nutrition to the cells, but it also prohibits the excretion or moving of the toxins out of the muscles and ligaments, so they build up as these knots. Left one's worse, isn't it?
Yeah.
Yep. There we go. Okay, let's turn you on your back. Now, this next adjustment is a diversified cervical rotary brake. There we go. One more here. Now, see, I already did that on the decompression table, so we didn't get a lot of movement on that one. We're just stretching out the tissues. Now, I'm going to be adjusting his extremity. There we go. Did you feel that all the way up into your pelvis?
Yes.
Good. There we go. Same thing.
Same thing.
Now, I'm going to move you down this way a little bit, Eloy. There we go. Yeah, anybody that thinks chiropractic is easy, slide down just a little bit more for me, has another thought coming. This is where I get my workout every day. There we go. And just breathe normally. I'm going to be adjusting your shoulders. There's the AC joints. Now, I'm not choking him. I'm adjusting his sternoclavicular joint, the costosternal joint here anteriorly, and the costosternal joints now on the right side. Now put your hands right here and just relax. Take a deep breath in. Let it out. Now, I'm actually getting on the top of his stomach, and during his exhalation, I'm pulling that stomach, there we go, Inhalation. Pulling that stomach back down below the diaphragm. You probably feel that gurgling and pulsing even. You want to make sure you're below the xiphoid process to the base of the sternum when you do this. Very good. Excellent. Okay, now let's sit you up sideways and face that away. There we go. Now let's come back this way just a bit. Very good. Because he's had crepitus or grinding in his shoulders, I'm going to be adjusting both shoulders, elbows, and wrists. And I'm sure you probably heard that one from all the way over there. And you always want to make sure the patient's looking straight ahead and relaxed. There we go. We got full range of motion, no clicking at all. Good. Let's check your elbow here. Just relax your whole arm for me. Excellent. There's the wrist, carpal bones. These are the phalanges, the fingers. So we get everything. And we'll be adjusting now the left elbow. Perfect. And just relax your whole arm there. There's your left carpal bones, radius and ulna. And again, the digits. And now I'm squeezing the radius and ulna together and the carpal bones and pulling his hand straight out so we can create some decompression in this carpal tunnel region, which houses the median nerve. Very good. Okay, now let's come over here and stand in front of the mirror again, Eloy. We finish every patient's adjustment by doing a procedure with this instrument, which is a high velocity, low amplitude, specific adjusting instrument that we will use on his atlas, sending signals into his cerebellum, called neuromuscular reeducation. We're going to put him in a mirror image posture while doing this. So let's flex your head forward and backwards again. And then back to neutral. Now see, he's still got that forward head posture. Okay, you can open your eyes. There you go. Do you see what I'm seeing there, Eloy? Mm-hmm. Let's pull these up and back. Like this, flare them out. Now I always teach our patients their own home therapeutic exercise. And this is Eloy's. We're going to tilt that just like that. And we're going to shift your pelvis straight to the right. No, there you go. Now let me have that hit all the way back here. There is the atlas on the right. Now you notice I actually have him in an exact mirror image, you can relax now, of his current biomechanics so that we can retrain the cerebellum how to hold him in place. Now flex forward and backwards again. And back to neutral. Take a deep breath in and relax. Much better. We still got one little thing that we're going to work on here. Now, he looks down a lot during his activities of daily living, so I'm putting him in a negative theta X cervical position. And again, we're adjusting that atlas. Let's try that very same thing one more time. Forward all the way. Backward up. Much smoother. Much better range of motion. Look at that. Straight as an arrow. Can you tell the audience here how this is done for you just with the few treatments we've had so far?
Oh yes, it's been a great improvement on my blood pressure.
Yeah, and that's another thing we'll get into. The atlas surrounds the brainstem or the medulla oblongata. Actually, chiropractic adjustments will help blood pressure through the autonomic nervous system. So, when we adjust his atlas, it affects the medulla oblongata. That controls cardiovascular function and respiratory function. We've got a lot more things to go over with you. This is your Houston chiropractor, Dr. Gregory Johnson, and we'll see you next time.